The International AIDS Conference gets underway in Munich, Germany today. The conference will bring together government officials, scientists and those affected by HIV and AIDS. The UNAIDS will release a comprehensive report on the impact of AIDS in different countries. SABC International News editor Sophie Mokoena spoke to UNAIDS Executive Director Winnie Byanyima on the report's content. Byanyima says developed countries should assist developing nations to acquire new technology in the fight against HIV/AIDS.
A host of factors that are rooted in the social conditions of the mothers lead to transmission. But we can change that. And it is changing, and some countries are achieving an end to mother-to-child transmission. This is the greatest gift a woman can have, to give birth to her baby without the virus, even though she has it in her body. We can achieve it. We can address those. We know how to find them. We know what to give them, and we can follow through. But we need to address this host of factors around that stop them from coming forward.
Well, when we look at the report, you are saying AIDS is at a crossroad. What does being on the right path look like? How do you get to the right path? But before you even get there, what do you mean when you say AIDS is at a crossroad?
What I mean is that this disease has been with us for 40 years. We still don't have a vaccine to stop it or a treatment to cure it. But in between, we have a host of technologies for prevention, such as condoms and PrEP and the ring, the vaginal ring, a whole set of tools there. We have diagnostic tools like a rapid test that you can use on your own and know your status. And then we have a range of treatments that are coming through and others already on the market. Everyone can have what they need to avoid getting HIV or to get on treatment and live a healthy life. But it's not happening. So we are at a crossroads because we've come so far and got 30 million people on treatment. That's a huge achievement that they've tested, they have got on treatment, they are living healthy lives. But we have a 10 million that we need to get on treatment, and we have to stop that tap, turn off the tap, 1.3 million newly infected every year. Now, I say we are at a crossroads because we know what we need to do. We can take that route that gets us to end this, and that is put the money down for the response. Support the countries that are highly indebted to have the fiscal space to pay for sustaining their response. Support the joint program. That's us at UNAIDS who are on the ground helping countries to fight. That money is needed. That's part of the road. The second part is the rights issue. Decriminalize, end stigma and discrimination so that those who need it, gay men who are hiding, sex workers who fear to be mistreated at facilities, people who inject drugs who also fear arrests, let those people come forward to get what they need. So decriminalize LGBTQ rights, decriminalize same-sex relations, decriminalize sex work, then fight stigma and discrimination. The third part of this road is to share the technology. Right now, one company called Gilead has a life-changing technology. This is an injection that you can take twice a year and you won't get HIV. But it can also be a treatment so that those who are living with HIV can also get an injection and live without having to swallow tablets. That's if it's combined with something else. But this company is holding on to its technology and selling it at a high price in rich markets. If we can persuade Gilead to make a plan to share the technology with generic producers, the price can come down to $40 a year, and all the people in our developing countries can be served. That's the road. Pricing, getting technology in the hands of all who need, resourcing the response, helping indebted countries to fight and keep fighting, paying for their response, and rights, the pushback, this pushback against gender equality, sexual and reproductive health and rights, LGBTQ rights, and the closing of civic space is pushing people away from services.